A warm welcome to another Behind the Badge LinkedIn live session with Confare. I'm very happy to have Marc Besson with me in the call. Marc, great to see you again.
Thanks, Michael, and thanks for inviting me.
You know the CIO Award and the CIO Summit for several years. We have our 15th anniversary, which is a great occasion for us, and I'm very happy to see you in September at the event. You are the CIO of IMAD. Maybe you can introduce this organization for us a little.
That's for sure. IMAD is the largest home care organization in Switzerland, similar to what you know in the Swiss-German part of Switzerland as Spitex. So we deliver home care to the Swiss and to the Geneva population for more than 18,000 people per year, servicing more than 8,000 persons per day and delivering 500,000 meals per day, just to be sure that we can keep the people at home, mostly elderly people, and prevent them from institutionalization.
And what is your role as a CIO in this organization? How important are IT and digital technology in this kind of organization?
I've joined IMAD 5 years ago, taking the role of CIO or CDIO of the organization at a very key moment, because that was really the beginning of the digital transformation. I used to perform digital transformation in the past in the private sector, in the e-commerce and retail sector, and I joined a new sector where digitalization was at the beginning. For home care and healthcare, digitalization is the key for the futures, because we're lacking a lot of pressure, we're missing some care workers, and we need to have digitalization to transform it. So I've joined the executive committee 5 years ago to launch this transformation, and we did an amazing job transforming IMAD as a key digital player in the healthcare sector.
It's very interesting when we see CIOs from the public sector and the health sector at the CIO Awards, because it also makes me kind of proud, because you see that digital transformation is not only a thing in private organizations and large enterprises, but also in these very important sectors of our daily life.
No, that's for sure. Digital in the healthcare sector is very key. We need to be sure that we have the proper information at the right time, at the right place. And when you're dealing with home care, that means that I don't have only one site and one location, such an hospital. I have 18,000 sites where I need to be sure that my information system and the information is available on a timely manner, 24/7, and that's really key in this organization to provide the proper care to the proper person.
And of course, issues like privacy and data security are very important in this kind of environment.
Of course, privacy is important, but basically the people are giving all the information already on the cloud at a private level, and we need to be sure that we have the proper solution. That means that when I joined IMAD 5 years ago, we had no cloud at all, and we're pushing towards implementing cloud solution. So what we've done is that we've completely rebuilt an entire framework that's enabled us to go to the cloud with a secure manner. So that's means that we properly protect the information, protect the sovereignty of the information, but we currently using cloud solution to be sure that we have top-notch and state-of-the-art solution.
It's something you can't really avoid if you want to provide real state-of-the-art services.
That's for sure. That's something we've implemented. For example, we need to use the AI tools, and we've implemented some solution. We'll not reinvent them. There is amazing solution on the market. So we now develop solution based on Copilot from Microsoft, for example, but having the security embedded in the solution and being sure that we have a secure tenant with bring your own key and all the encryption mechanisms to be sure that we protect the information that our patient give us.
You mentioned the special sector your organization is working in, and I think it's part of modern healthcare that it's increasingly shifting from hospitals to patients' homes.
Yeah, that's definitely what we call the ambulatory model. And we cannot build hospital and more hospital. The cost and the limitation of the caregivers are a real challenge for us. And ambulatory solution and home care solution are the futures from the healthcare sector.
How does the digitalization you talked about earlier enable this kind of change in the healthcare system?
Digitalization, sorry, is key for that because we need to be able to provide the information that you originally have in an hospital, in a patient solution system. We need to have that mobile, and we need to be sure that we are transferring the information from the various professionals. So from the GP to the hospital to the physician to the nurses on the field that we have, we need to be sure that we have a continuum of information to be able to take care of the patient. And that's what digitalization enables.
IMAD has implemented one of the first production-grade AI use cases in Swiss home healthcare. What have you learned from that experience?
That was a real journey because we look at AI for a long time and we try to define the proper use case for AI, not just a toy or just a demonstration solution. We want to implement it, and that makes sense for our employees and for the caregiver that we have. So we made a lot of analysis, a lot of pilot, and last year we created Ariane, which is the name of one of our AI solution, which basically take more than 2,000 pages of procedures because healthcare is based on procedures and solution. And we implement that on Copilot solution that we could specially customize for us. And now this AI solution, Ariane, is like a new employee in the pocket of each of our nurses, where you can ask question about all the procedures, all the information, rather than searching in big binders and not finding the proper information. You can now have a chat with our procedures and find the proper way to treat a patient. And that was very interesting because at the beginning, the care staff were very reluctant to use it because it was just technology and they were scared about it. And we make a huge transformation and change management process with them, training them, demonstrating the solution, building and co-building the solution and co-developing the solution with them. And they know trusting this solution. They're using that on a daily basis. We have a huge impact on the productivity of the employee thanks to this solution. And what we learned is that you need to build trust for the employee. It's not something you can determine with a memo and sending a memo to the people use this solution. No, you need to build it with them and co-develop with them. And it was a pretty basic use case, but that's just opened the ideation mechanism. I know we have a lot of requests for new solution. We launched Ariane version 2 in September, an extended version with more information and more flexibility. In Europe, in the summer in Europe, we have a massive heat wave. That's a huge challenge for us because each day of a heat wave, we're calling more than 3,000 people to be sure that they're well and having proper rotation. And that's a huge pressure on the organization. And so we're testing this year a voice-based chatbot that is automatically calling people. That was unforeseeable last year or 2 years ago. And that's almost transparent for a patient. They're answering and there is all the analysis behind it. And that's what will be the future of AI and the evolution we're foreseeing.
Mm-hmm. Now, these are really interesting AI use cases that really change people's lives and how the people of your care staff do their daily work.
Yeah, they really appreciate those solutions. We currently building new solutions. We have a research team working on that. We've developed, for example, a predictive model because we're making evaluation of all our patients. That's part of standard procedures. And based on all the information we have on our care solution, we have all the history of the patient, and we've built a predictive model so I can almost forecast 6 months in advance when the patient will start falling. That's a key information, but that's a huge ethical concern because how do you explain to a person that you will start failing in 6 months and you need to take preventive measures? And that's also part of the ethical component linked to AI or big data, because that's something else that big data we have for many years that we need also to analyze and proper make it a reality for our caregivers.
When you design IT products and IT services, you have to consider that your healthcare professionals don't work in a hospital environment, but in really patients' homes. How does this change how you design, how you build your architecture, how you create IT services?
That changed everything. To be totally transparent with you, that changed from the infrastructure because we need to be sure that all our solutions are totally reliable and working 24/7, and that's a question of architecture design. We need to be sure that the mobile, because they all have tablets and mobile phone, We need to be sure that also all the application we developed could work in a wide zone, because Geneva is a pretty developed area, but there is still a lot of white zone where you do not have data connectivity. So we need to be sure that all the solutions developed also work offline and replicate all the data, even in a new building, because there's such environmental protection in the new building that there is no waves that enter the building. So we need to be sure of that. And we need to have solutions that are, from a UX perspective, very simple, because they do not have 10 minutes to boot a computer. It needs to be run, it needs to be fast, and they need to have access to the information as soon as they're interacting with the patient. Mm-hmm. And as we have many caregivers taking care of a specific patient, we also need to be sure that all the information is replicated and available instantly to the entire team.
In your personal history, you worked also in retail organizations. How is it different?
It's very similar and very different. It's very similar because all the concepts I've implemented in the retail environment in the past, I can then replicate them in the public sector and the healthcare sector, and that's a huge advantage. And it's also totally different by the fact that working in the retail or in the past in the banking sector, I many times heard this application is vital. And I also say many times this application is vital. Doesn't mean anything because it will not kill somebody. The application I'm currently running and the infrastructure we're running at IMAD are really vital. If we have a failure, there will be impact on the life of somebody. So we need to take care of that, and we need to be sure that the way we design the solution are fully reliable and redundant.
While building these kind of applications and services for your professionals, you also changed the role that IT plays in the organizations. What can you tell us about this way from service provider to business partner? I think it's a way many of the CIOs in our community are now going. I think you are quite successful in this way.
Yeah, when I joined IMAD, IT was just a back office or support function. That's not anymore the need from our business. So I totally transformed this vision, being part of the executive committee that's enabled me to also have discussion at the top level and to demonstrate that the IT is part of the core knowledge of our employees. That's not something that is subsidiary. And you're able to win this, not this battle, but this co-building with the care team by speaking their language, understanding their needs, and being able to provide new solutions that will simplify the way they're working or ameliorate or improve the quality of the service they're delivering. And by doing that, it's also very important to have part of my team that are former caregiver or nurses that have moved to the dark side of the force, let's say so, moving to IT. So they're able to interact with our professional and understand their language and their needs. And that's also part of my personal background because many years ago, I've been trained as a military nurses in Switzerland. I'm not able anymore to provide any type of care except repairing a computer, but not a human. And that's also part of the way I'm able to interact with my colleague and being at the table of the health solution and not being just a support provider.
As you mentioned before, IT is vital for the services your staff provides. Did this change your view or your perspective on the role of the CIO?
It's definitely changing because we know a change enabler. We need to be sure that all our employees are the proper digital literacy, which is not part of the core competencies of the nurses. Nurses is there to provide care and to know how to do an infusion, but not to how to use a computer. And we made a huge transformation program called CAP Digital and Boost, where we defined that we need to boost the competencies of the employees. So we train them, making more than 200 small e-learning modules and teach them how to use the tools and to be sure that digital is part of their core competencies and not the side competencies. And that's also part of the transformation. And the CIO is here to enable this transformation and be sure that they have the proper knowledge on top of the proper tools.
You describe a role with many possibilities and many chances to create great solutions. It also includes high risk and much pressure for you as a CIO. How do you deal personally with it? What is the secret of your personal resilience?
you need to have a great team, which I have. I have 100 digital professionals working with me to be sure that we're able to support properly. And you need to be very transparent with the users. It's happened. We have failure from time to time. That's happened. You need to have a business continuity plan that is top-notch, what we have currently. And we're testing that every 2 weeks because that's the kind of solution we need to be sure it's properly working. We generate a PDF of the care plan every 2 hours, and that's part of the manual process. So being sure that those BCP and continuous procedures exist, having a top team that is able to support the solution and being involved in all the key decisions in implementing the proper solution. That's the way you have resilience. But of course, and to be transparent with you, I'm not very well sleeping every night. When we have a major issue, that's part of my responsibility to be on board and transparent with our users.
You are nominated for the Confare Swiss CIO Award. Congratulations for this.
Thanks.
A great story you have to offer and to tell to our community. We are doing this for 15 years now. This CIO Award has quite a history now. So yep. How do you think the role of the CIO changed in this past 15 years?
That's really what we said. We moved from a support function to a key executive function. Basically, what I did at the beginning of the year, my department was still called IT Department, Information Technology, and we rename it as Digital Services. And that's not just a branding issue. That's really demonstrating that we know part of the service and that we deliver service to the employee, but also to the community and to our patient and the family. And we provide digital services. We're not called digital transformation at IMAD because digital transformation is done. Digital is our reality and is the reality of all our employees. So we're not called digital services, and we embedded in delivering services to the organization and to the end users, so to our patient. And that's the transformation happened in the last 15 years.
Exciting. What does this CIO award mean to you personally? Why is it important to give IT a stage to show itself and to show what modern IT departments can deliver in services and part of the success of a company?
First of all, it's important because I've moved from private sector to public sector, and it's also important that to demonstrate that public sector also could have a case and what we did, because we implement quite a digital transformation that is seen as impressive, at least for me, and also when I'm exchanging with my peers. And that's also a way of having a recognition from my team and also a leverage to be sure that we have the proper recognition, the proper budget, the proper resources to continue this journey, because the journey will never be ended. We have a lot of transformation in front of us in terms of transformation of the model. We're thinking about the home care solution of the next decade. We all know in the security and IT industry, we have a SOC, Security Operating Center. We're thinking at IMAD of developing a HOC, a Health Operating Center, something similar, but we'll monitor not a computer, not a server, not a firewall, but somebody at home remotely. So that's a new vision, that's a new profession that will need to be created. Digital nurses, something like that. So it's also a way of putting that in front and demonstrating what we will do in the futures.
It was an exciting journey by now, and it will be even more in the following years. Good luck for all the projects you have and the exciting initiatives you lead. I'm very looking forward to meet you at the Confare Swiss CIO Summit in September. And yeah, great luck for the CIO Award. See you soon.
Thanks, Michael, and thanks for having me today.